Hey everybody, welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week, someone new, different perspective, different specialty, and today we have a really awesome special guest that I want to introduce you to. And so today we have Amy Vander Linden. She is the owner of Moment of Truth Physical Therapy in Arizona. Amy, welcome.
Hi, I'm so excited to be here.
I'm super excited to get the ball rolling. I know we have a lot to talk about today, and I'm just so impressed. I mean, obviously, I did the deep dive on your website and we've talked, and I think you're incredible. And kind of how I like to start things off is, I think everyone is truly inspired by everyone's origin story, what inspired them to open up their practices. How did they get to where they are today? So I would just love to hear, what that is for you.
Thank you. Yeah, I first got interested in physical therapy overall when I broke my hand playing volleyball in high school and really love anatomy, really love sports related things. And so went to PT school, thankfully got in, went to University of Arizona undergrad, go Wildcats, and then grad school in Boston. So super fun city, 10 out of 10 stars, highly recommend everybody check it out, especially in October. But it's a great city, and grad school obviously was brutal, but also managed to have a lot of fun. I've worked in quite a few different settings. It's one of the great things about that career, I think, like nursing or some of the other OT speech. There's a lot of different settings that you can do physical therapy in, and a lot of different needs for different aspects of that. And so I did pediatrics, I did orthopedics, I did a wellness center, I did home health, lots of different pieces of that. And in 2009, we have to take continuing ed classes every year, and I really started diving into myofascial release work and felt like I definitely found a deeper calling. And most of the time we go to continuing education classes, we get more tools for our toolbox. And this was very different. It changed me as a person. It changed so many aspects of how I see the world and who I am that it just felt a lot deeper, obviously. And so started taking all the different John Barnes myofascial release classes, one of which is pelvic health. In the meantime, actually just before I'd had those two classes, I had my kids in '05 and '08. And so then I started taking myofascial release in 2009. And so just really grew that and started my own practice, created an LLC in 2012. That was kind of an evolution in of itself. I was still doing home health and different things. Really started focusing on just my practice in 2014 and gearing more towards pelvic health in 2015. And so,
Amazing.
gosh, that's already 9 years ago, almost 10. And so that's really kind of how it shifted. Part of it was that I myself had had kids. A lot of my friends were having kids. And even I already thought myofascial release was like such this narrow niche, and then pelvic health, myofascial release, it's the tiniest niche of all time. And even within all of that, there's a million other pieces. I'm extremely passionate about sexual health
Mhm.
and helping men and women have their best sex now. And I'm extremely passionate about education and talking about all the things that most people don't talk about. And I happen to also treat men. And so love the pregnancy and postpartum. And there's a baby in the room next door right now. But I love the pregnancy and postpartum piece, but it's so much more than that. It's really everything from puberty on perimenopause, menopause. There's just so many different things that could contribute to issues and needs, most of which are still largely unknown by the population.
100%. And I love your journey because you have gotten so many different perspectives through all the different types of work that you did. And then you found your aha moment. You were like, okay, this is kind of what I'm meant to do. This is what I'm really passionate about. And it comes at such a spectacular and funny time as, I had entered motherhood and my friends are entering motherhood. And I love talking about things that people don't want to talk about.
Yeah. Yeah, most of the day is pee, poop, sex, body parts.
Yeah.
Yeah.
People, and I'm so glad we're talking about it now because I wish that it was more common, and I wish there wasn't whatever stigma or connotation you have with it is attached. I think it's just normal life, and everyone has their things, their issues, but would love if we could talk about them more, which kind of leads me to, you do a lot. You have a lot of experience, but what do you find right now are the most common areas that you're treating or just really finding people struggling with? And whatever you want to dive into, I'm on board.
So I think the top things that we get people calling about is either pain, whether that's just pain in everyday movements, whether it's pain with sex, postpartum healing, all of those things usually involve pain, hip pain, back pain, tailbone pain, as we are able to educate people that men and women both have muscles in the pelvic floor underneath their glutes that we're never taught about or told about. And they can become inflamed, injured, dysfunctional, just like our shoulder or our quad or our glutes. So sometimes it's people just realizing I've already tried all these other things for my hip pain. Maybe it's coming from my pelvic floor. So there's that chunk. We deal with a lot of post-surgical things, abdominal surgeries, pelvic surgeries, hysterectomies, concerns about prolapse. A lot of times we're able to help clients avoid surgery. That's one of my greatest joys.
Mhm.
And then we definitely get the deeper trauma pieces. I think for women, it seems to happen a lot in our 40s where we realize, Mother Nature's not messing around. Life is passing us by. And if we don't fix our healing, whatever that means, right? Find ourselves, whatever words you want to attach to that, get deeper healing, deal with our baggage, you know, help our perspective and not have such skewed wounds that our lenses are functioning through. Whatever that looks like for people or however they want to put language to that. We have a distinct chunk of clients that are here for what I would say is deeper healing. They know that their pain isn't just from doing too much shoulder work at the gym last week. They know there's been off and on shoulder things that have to do with control and maybe some childhood wounds. And not that everything has to be complicated or deeper, but a lot of the fascial work we do goes along with nervous system things. And obviously, when we're dealing with sex and sexuality, if you even just think about miscarriages, fertility struggles, abortions, birth trauma from things not going as planned or as hoped during delivery, difficulties recovering, rejection, abandonment, saying yes when you didn't mean it, like all, or saying no. And, then there's more dramatic things like childhood molestation, rape, trafficking, all of these pieces, right? And the chance that someone's walking through the door without some trauma is not likely. And I really enjoy redefining trauma. This came up with a client yesterday where I asked her if I could use the example because she remembers when they had, she grew up on a farm and the expectations for the labor that would occur on the farm were just, that just was the way it was. Sunrise to sunset, the things with the animals. And it was for food and for provision and for putting, food on the table. And that's how the family made their money and all the things. And she remembers being very traumatized when the cows would come get butchered, even though and so she's like, yeah, I probably have some of that trauma in me. And so I said, that's such a great example. Or like the death of a pet, or you have a parent who travels for work and your 8-year-old, let's just pick an age, right? Your 8-year-old mind might understand that your mom has a job or your dad has a job and that they go to work and that sometimes they travel and in some part of you that they're coming back, but maybe the trip was longer or maybe you heard mom and dad fight before the trip and somewhere you imprint they're never coming back, I've been abandoned, right? And then they come back and it's whatever, right? But you don't know how our different ages and our different selves process all of those things. Or maybe you were a child and your mom had a miscarriage of a sibling and you don't totally understand what happened, right? And so trauma isn't always these huge, rollover car accident that I took a year to recover. It is that for sure. And it is rape and it is all these other things, but it can also just be the layers of life that happen.
Yeah.
And so I love diving into that with people.
I think one, this is the craziest thing. I had just interviewed someone that's out in California that had said the same thing today. And they had this perspective of you have trauma living on this earth. We think of trauma to be these big traumas, right? These life altering, shattering things, which they can be,
Yep.
but oftentimes we have these little doses of traumatic things that happen to us that we don't ever really heal on. We just kind of let it pass on by. We don't recognize that it maybe is there or getting in our way or how we might handle a situation, but it's there. It's somewhere underneath that rug that we haven't pulled out. And so I love that you are talking about this because it's so important to recognize, and it's great that you're helping people in this way and to uncover that so they can get the healing that is needed. And it may not be a healing that they think in their mind right away, oh, that applies to me, or oh, that's what I should be doing. But I love that you're showing people that there's more than one way.
Yeah, definitely. And myofascial work. So the other thing I'd like to talk to clients about is that when we're processing trauma, I think a lot of people don't want to open that proverbial Pandora's box because they're worried what's going to come out. And maybe they're like, I know there's stuff I don't consciously remember or know, and I kind of don't want to know. And the great thing about healing from trauma is you don't have to rehash it. You don't have to relive it. But that does require some sort of therapy typically that gets to the subconscious because we have these, like you're saying, life happens, mental things, emotional things, physical things. Breaking your arm as a kid, you might think, well, ho hum, I knew I broke my arm and I healed and life goes on. Well, there could be pieces in there, right? And so as those layers happen to us, they can be healed and integrated to where they're not any longer triggering you or not any longer affecting your responses
Yeah.
and your reactions in ways that aren't about the present day moment. That lens that's layered on is creating different reactions and responses that maybe you wish they would. And so myofascial release is one way in. We also do work with TRE, which is tension and trauma releasing exercises. We have a workshop for that coming up. Kate Ship and I are doing an all-day intensive workshop on healing your nervous system and ways that you can continue doing some of that work for yourself. I go to her for somatic breathwork sessions. There's EMDR, there's tapping, there's brain spotting. There's so many ways to help the body integrate and to get to those subconscious pieces and to be a bit more whole and healed. And I love that at least we can provide a couple of those here. We have emotion code therapy, which is another way of kind of scanning the body and helping stuck energy move. And again, you don't have to rehash, relive, reprocess all of it. And I think that's just a beautiful gift of healing that a lot of people don't know or understand. And so they just avoid it.
Completely. Yeah.
It's heartbreaking.
Yeah, I totally get that. And I'm with all your experience and all the different modalities that you use in your office, and if you have any more, I'd love to hear about them. But what else about your approach that you feel is just completely different? Which it is. Like you've already named so many things, but is there anything else that you'd say is just so completely different and unique to you, that you love to do?
Yeah, well, I think I'd like to take a moment just to speak on pelvic PT because that's not universal. You could have 20 different pelvic PTs and you're going to have a different experience with all of us. And that's just part of the nature of healing. And same thing would be if you went to 20 different chiropractors, right? To a degree. But because the public already doesn't know a lot about pelvic physical therapy, what we do and how we can help, I have some content about that and what to expect from your session, specifically what to expect here and what to look for in a provider in general, because I think, I have a colleague and she goes to people's houses and she focuses on postpartum recovery and does a lot of really great work. Sometimes I find it confusing that she calls herself a pelvic floor therapist because she doesn't do any internal examination or treatment. And to me, it's just confusing, right? And so internal vaginal work is part of a thorough pelvic exam.
Mhm.
Sometimes rectal work is needed as well. We deal with a lot of hemorrhoids, constipation, fissures, and it's different contact with the musculature back there. And a lot of us just hold tension in the pelvic floor, and that inevitably involves those more posterior muscles. Treating men, not all pelvic PTs treat men. That's an individual choice each provider needs to make and has every right to make. But I know a lot, like when men don't have as many issues with their pelvic floor historically, but when they have an issue, they're even additionally up a creek because so few, like I would say less than 20% of total pelvic health providers treat men. I think
Wow.
that's growing and changing. I don't have any exact numbers from like the APTA or anything, but um, so I
Hmm.
think also I came into the work through the lens of the Barnes myofascial work as opposed to becoming a pelvic PT first. And
Right.
so with myofascial work, we still treat the whole body. I had two clients last week who were very relieved that we have the approach we have. And even though we're a cash-based practice, I know that is challenging for some in terms of not using their insurance or whatever, but they were very grateful. One had been on a trip and like did something weird on the plane and her neck was a mess. Another had slept funny. She has a newborn and co-sleeping and her neck was a mess and she had a really bad headache. Because of our setting and because of my training and our approach, I 100% will treat their neck and help clear down the spine. And they don't have to go back to their doctor for another prescription. They don't have to wait for a referral or authorization because we only had a script to treat pelvic and now so it just removes a lot of those barriers to care and I can address whatever I find. I might have a neck, headache, migraine patient who's mostly here for cranial work and alignment. And I pick up on a lot of things going on with her sacrum and her pelvis and that alignment. And so then I'm able to treat whatever's kind of at the root cause. So I think all PTs want to help their clients have lasting healing, but with doing the fascia work, with your fascia is just your connective tissue, it's head to toe. So trying to get to the root of those patterns and those lines of tension, it's like, okay, you have pain in your right shoulder,
Yep.
but the left side's actually really locked up and that's where a lot of the tension and pull is coming from. So we just sort of sort all that out as we're working with clients.
Well, not enough people talk about cash-based practices. And I love that you brought that up because insurance, there's an aspect where you can understand it and why it exists, but also it is so difficult in the way that you cannot treat a patient the way you know they need it, because that gets in the way. And so I love that you brought that up that, like, hey, they don't have to do certain things because I can treat exactly what they need right in that moment. It doesn't need to be coded a certain way. So it can be approved by their insurance company. I can do actually what they need in the time that they are present here for. So
Yeah.
I think that's a golden opportunity that people just may miss the mark on or don't understand why or the benefits of having a cash-based practice. So I love that you had brought that up.
Well,
Really,
thank goodness for like HSA and FSA accounts. And we do provide super bills if people have out-of-network benefits, but insurance is covering less than and less. And even in insurance-based practices, women are still, and men to some degree, are still fighting that battle. Like even if you went to a clinic, I know Spooner's a chain here in Phoenix, they do all insurance for whatever issue, whether it's pelvic, shoulder, whatever. And you can't just submit a code for pelvic pain or painful sex or even incontinence, which is the leaking pee, or
yeah,
prolapse, which if we can help cure prolapse, we're helping the insurance company avoid paying for a very costly surgery. They're not reimbursing for those codes well, even in an insurance-based setting. So we're ending up having to focus on the orthopedic codes, the hip pain, the sacral pain, the tailbone pain, the muscle spasms, muscle weakness, scar tissue codes, even in those settings. And so, yeah, we still have a long way to come with really quality all-encompassing healthcare, unfortunately.
Yep, so many times I feel like I'm on here with providers and we're like, man, if we can just figure a way to, figure out US healthcare, that'd be amazing. It's so complicated. It's a
Yeah.
beast, but I digress. I would love to though talk about because one with everything that you do and you talked about, men are pretty much seems like really underserved.
Mhm.
Yes, statistically they may have less, pelvic floor issues than women, but there are a lot of misconceptions. There's also, you know, things that you might make certain connotations to or how you feel. You look things up on the internet because it's so accessible now and you might not always get the right information. And so to that point, with all that being said, what are some things that you hear time and time again that you're like, I wish you didn't read that, or that's half true, not all the
Oh,
way down. I see you.
myth busting is my favorite.
Okay,
We just
good.
had an email that went out this morning. We do a Wellness Wednesday email every week,
Nice.
and myth busting is my favorite. So one is that Kegels are the end all be all for a woman's pelvic health.
Mhm. Mhm.
Half, more than half the time, I'm teaching clients to relax and downtrain the pelvic floor, and that is agreed upon vastly across pelvic PTs. We all rant about that one. I think another one is that if you've had several babies, that leaking pee or pelvic issues are just part of life now. Same for menopause. Well, you're old. What in the actual? So
Beep.
those are some of my favorites. I think men are really left with Reddit online. That's the platform where men talk to other men about stuff. I think the other misconception with men is that they're pretty much all set until they're old enough to have prostate issues or flow issues or ED, erectile dysfunction. And
Yep.
so I've had in just the last few months a 21, a 22, another 22 and a 35-year-old client on my caseload, all men. And they're put through the ringer on the STD thing too. I think ruling out UTIs and STDs is a completely medically appropriate thing to rule out that often can cause penile pain, infection, all those things. And these need to be treated correctly. But the assumptions about sexual promiscuity and like when the tests come back negative, them kind of not being believed about the
Mm.
issues in their behavior. I can tell, like I've had several clients that are pretty hurt and upset by that, for men especially. And I mean, just like women, all three of my younger clients that had some testicular discomfort as well, even though their UTI and STD tests came back negative, they still threw antibiotics at them. They said, well, it could be something more missing. Just take this, which is going to wreck your gut. And again, so many things, right? I won't go on a tangent. But
That's hard.
so I think that that's why lately I've recorded a lot of content about just the basic anatomy down there and that we have muscle pain. And this one client, I'm so thrilled he's here because he's only 21 and he figured it out for himself that he had some muscle stuff going on. He thinks he overstretched it initially with MMA and he has a bit of pudendal neuralgia, but because he got in here so quick, sometimes these guys, it's like 9 to 12 months by the time they've seen 6 different providers, urologist, proctologist, their regular doctor, blood work, all these things. And when they've had pain that long, their body's compensating and it takes more sessions to fix. And so he's in here and we're turning it around really quickly. He's suffered for less than 3 months and it's going to be so much easier to help him. And even though he's young and doesn't have a lot of money, I think that's something else to say about cash practice. If anybody's ever been to PT for like a knee or a shoulder or something, a lot of times you go 2 or 3 times a week for 12 weeks.
Mhm.
That's not how it works here. Most of my clients do really well with once a week. And I would say on average, 8 to 12 sessions. So yes, it's cash. Yes, it's pricier, but it's fewer sessions. It's fewer time that you have, to schedule and get here, time away from work, potentially time to get childcare, potentially. Again, some of the deeper post-surgical things or really want to dive into old trauma, that might head into the 16, or we have clients that do maintenance where they just feel really good coming several times a year just to keep up with everything. But by and large, most of our clients do really well with 8 to 12 total sessions.
That's amazing. And you are getting better and getting better results faster. So it's like, why not? But it's such a shame to hear about all the struggles those people have gone through and how many people they have seen and not being believed and kind of I call like medically gaslit, like I
Oh,
that.
so common. Yeah,
It's crazy, like how many people I've talked to and hearing their stories and and precisely why people have decided to open up their own practices for this reason, because you care, you have an invested interest in these people, listening to them, their stories, how many things have been solved just because you're talking to them, you're actually hearing what's going on throughout their life, and you're like, okay, I think this could be linked to what we're dealing with here because you actually sat down and had time to talk to them. Um,
exactly.
it's wild to hear all that. I mean, I love the myths that you debunked. I mean, I definitely hear them. I know some of them are common, but it is so sad that it's taken people sometimes this long, to figure out their solution, because there's so much junk that's out there. Yeah,
Definitely. And yeah, we talk a lot about common versus normal. It might be common to have issues leaking pee with coughing, sneezing, jumping if you've had 4 kids, but it's not normal and it's fixable. It might be common to have pain after childbirth or with a C-section scar, some of the numbness and tingling from the scar and how it heals. But
Yep.
that doesn't mean you have to just live with it and suffer. So yeah, we kind of have a tagline of no settling, no suffering, no shame,
Mm,
and just trying to really help people feel seen and know their own bodies so they can really take control of their health.
absolutely. And one thing kind of to round out for today, I'd love for you kind of a two-pronged question as to, giving some advice to people, that are maybe starting their journey today, on the patient side of things, of seeking help or realizing that hey, I tried so many things, what should I do next, or just common homework that you might give to someone after they've come to see you. Would love to hear some of those pro tips, but then also on the clinical side, I think the people that come here and watch this are interested in learning. They want to know more. They want a different perspective as to, what they have been doing and maybe incorporate something that has been maybe fantastic for you in your practice. And they can say, oh, hey, great. Like, let me go and try that. That's a great idea. What are maybe some pro tips for, other people that, are in your position that are, you know, in a demanding private practice?
Yeah, great question. So, on the pro tip side, we also have a yoga studio here, and people always think like I'm a yoga instructor or a yogi or something, and I'm not necessarily. But why I was so passionate about finding a space where we could have a yoga studio and have workshops was because we severely underestimate the extraordinary power of breathing well. And nothing in our world helps us go inward, right? We all want someone else to tell us what to do and how to do it the quickest, fastest, most effective way possible. Ideally, the least expensive also.
Yep.
And we're just so programmed for quick solutions and quick answers and quick results. And so it's very important to me to not create a feeling where the client's reliant on me as if I'm healing them. We really try to help them. Like we talk all the time. John Barnes has an article where he says awareness, without awareness, there's no choice. And I have a lot of content and talk a lot with clients about awareness as a superpower. And I think yoga really helps hone that. Especially my favorite is yin yoga, which is slower. It's more restorative. You're holding the poses longer. So we get into those fascial connective tissues. You're getting more lasting changes. It's very gentle. I tend to be a pretty driven, go, go, go person. And yin not only slows me down, but it reminds me that we actually have the most lasting positive results in tissue mobility and flexibility when we go at about 40% into our stretch. It's not that painful 90% go right to all the way to the edge and through it kind of work. And that's what fascial work is too. It's sink and wait. Let the body feel safe. Let the body respond. And so my first pro tips would be try some yin yoga. And there's tons of online resources and YouTube stuff. I love Travis Elliott. We have yin classes here also because of that, but try some yin yoga. And then there's a million styles of breath work also, and breathing well and slowing down and feeling what your body is telling you. We usually get hints and whispers. Then we get pain, which is a little bit louder. Our body is talking to us. We can listen, we can heal. And so I think just not getting too reliant. The internet is an amazing resource. It can also be a pit from hell. And so use it and be careful, which is not all that helpful. I think we kind of know that. But I would also encourage people, if you meet with a provider and something doesn't sit well, now, especially if it's something egregious, like they don't listen to you, they gaslight you, all those kinds of things, of course, just run. But even if you meet with two providers who are knowledgeable and one recommendation you really connect with and it feels right to you and the other you don't, but you think they might be more of an expert or something, trust yourself.
Mhm.
Trust yourself. Trust your body. You can always go check in with something else later. I say the same thing regarding like surgery. Think too about what's going to most limit your choices. If you go get surgery, that's just done. So even asking the surgeon, if I try this for 6 weeks to 3 months, what's my risk? What's my downside? Informed consent's something I talk a lot about too, because I think it's missing. We go into an office, we're given an opinion. Truly informed consent is this is what I'm recommending. This is why. These are the positives. These are the risks.
Mhm.
These are the factors to consider. What is your choice? And I think so often medical providers are just doing things to us, not even not even maliciously. It's just everything's so fast paced and everything we fall into our own ruts. And I have my own ruts and my own biases and all of that. And so I really encourage people like, if somebody came in here and they didn't connect with what I was saying and they didn't feel like I was addressing the true problem, I would 100% want them to A, question me, and then B, leave. Like, we're not a good fit. And you're not going to be a good fit with every technique or every provider. And I've encouraged some clients, like, I don't think this is the right thing for you right now.
Mhm.
Um, so, yeah, I think it's important to help people trust themselves again.
I love that. I mean, pro tip for both ways, actually. Yes, yes, things are fast paced and sometimes you don't even realize and you're like, this is what I recommend, but it's not like why. And here is the pro and the con of each situation that you're in. And just giving that patient all the knowledge that they can get about this so that they can make the best informed decision for themselves, whether they want to move forward or not, what makes them comfortable or not. I think in essence, we all do that. Sometimes we just beeline it to like
Autopilot. Yeah.
yeah, we know this is the path, this is the way. Like it's so clear to us that this is what this person should be doing. But not, it's not always clear to everyone else that they see our perspective. And so I think it's such a great pro tip for both people, the patient to be asking the questions if you're not getting it, if you're not getting, what's great about this, what could not be great about this, but also for providers, like where sometimes we go a little bit quick and because we see a path and we know it, but it's good to explain that so they can understand it too. And I think that's really, really solid advice to be given to both people is just ask questions and listen.
Well, another pro tip, some of my colleagues might not love this, but like another pro tip is a lot of us that have cash practices or concierge practices do some sort of, a lot of us call it a discovery session or some sort of initial consult. Some people it's in person, sometimes it's a phone call. Take advantage of those. Like
Yep.
our discovery session here, you come meet with me for 30 minutes and we talk about what your concerns are. Then I explain what we typically do here and what pelvic floor therapy is, or depending on the case, what myofascial release is if they're not coming for pelvic.
Mhm.
And have a chance to really connect, get more of your history. The great there's two great things. One, if they move forward with an evaluation, we've covered a lot of their history. And now that 90-minute evaluation that they're paying a chunk of money for, they're going to get a lot more treatment out of because I'm not going to have to cover all the back history stuff.
Yes.
We only charge $39 for that 30 minutes. Normally, a 30-minute session with me would be quite a bit more. But we want people to know what they're saying yes or no to. And so take advantage of those, because even if you paid me that $39 and came and you didn't want to necessarily move forward with care, or like you couldn't afford to move forward with care, whatever the case is, you'll have gotten all my advice. We recommend other providers in the area. We help connect you with resources. You know, I had a client who needed to deal with her jaw and airway more than she needed to focus on her pelvic issue, because financially and time-wise, she had to make a choice. I
Sure.
steered her to a colleague of mine that does myofunctional therapy and specializes in airway and oral mouth retraining and jaw and teeth and all the things. So we're very, very well connected in the Valley. And a lot of, even if you're all over the country, that's true of most cash practices. Go
Mhm.
take advantage of their consult. Go take advantage of their expertise. You don't have to move forward with the cash pay situation if it doesn't fit for you or you can't afford to, or whatever the circumstances.
Yeah.
But then you still at least get some advice from someone who's not as controlled by the other time and parameters of insurance.
Amazing pro tip. Yeah, that's one, it's so awesome that you do that, but it's also trust building. You want to serve the people the best way that you can. So I love that you're doing that. And to kind of put like a bow on everything today, I'd love for you to, tell everyone, how they can find you, reach out to you if they have questions, providers and anyone else that would love to
Yeah.
speak with you. I know you have a workshop going on that's coming up, so feel free to give us all the
All the
information,
shout outs.
all the shout
Um,
outs.
yeah, so I have two websites. Momentoftruthpt.com is our main physical therapy website. It's where everything is. You can get the link over to the yoga studio website from there. Workshops and events are on there. Um, Tons of video content. There's free resources. I have a bunch of free guides like a men's pelvic health, a lip and tongue tie for moms and babies, a pregnancy avoiding pain, postpartum recovery, all kind. What is pelvic PT? And in that resource, I talk a lot about what to look for in a provider. So it would be potentially useful to you even if you're somewhere else in the world. So the website, tons of content, and those free reports are right there on the homepage. Just scroll. YouTube channel, Moment of Truth Physical Therapy. Tons and tons of content on there. Some of my past podcasts are on there. Yeah, and it's broken down into some of the sexual health stuff, the shockwave therapy, postpartum and pregnancy resources, exercises, all kinds of information on the YouTube channel. There's also sexpertpt.com. That's where our climax and ED revolution treatments for shockwave, we talk more about those there. It's also on the other PT page, as well as I have a 1 hour sex webinar. It's called Have Your Best Sex Now, and it's just really helping couples connect on a different level and understand some key pieces that usually present in a relationship with one or both partners and how they can navigate that and have much better sex. So that's very passionate topic of mine. The workshop we have coming up is Kate Shipp and I. It's nervous system resetting, resilience, healing. We have lots of workshops coming up. The yoga studio, a lot of our instructors, we did a cacao ceremony. We have the aerial hammocks, so we have sound bath stuff all the time. Yin yoga, we've got a vision board workshop coming up. We have a TRE workshop coming up for that tension trauma releasing. And those are activities you can learn and do at home and help your own nervous system at home. So not all of these things are something where you have to continually keep coming or continually keep paying. We try to give a lot of resources. All of our clients get a home program with their exercises and stuff emailed to them because we focus on the hands-on piece in here. So lots of resources. If there's stuff you love content on and I don't have it, reach out and I'll see what I can get for you. We also have a blog that's on the website under resources, and try to put that out at least twice a month. Podcast was called Bellies, Babies, and Birth. There's 50 episodes of that one on all streaming platforms. And then the more recent one was Change the Conversations. I think we only got like 12 episodes of that in. So just some different health related and social related topics that we're just trying to have better conversations around and open up options for people.
That is awesome. You have a lot of amazing content. So people, go take advantage, go check out Amy. And Amy, we so appreciate it. This has
Oh,
been
thank you.
amazing, fantastic, great perspectives, and we hope to have you on again.
Thank you so much. Yeah, Facebook and Instagram too is just Moment of Truth PT or Moment of Truth Physical Therapy. I think Facebook, it's all spelled out. But yeah, Moment of Truth PT or Moment of Truth Physical Therapy, you'd find us pretty much on every main thing. And we love to help answer questions and provide resources.
Amy, you are like the best. Thank you so much. This is terrific.
Thank you,
And
Rachel.
everyone check out Amy, all right?
Bye, guys.